2, 3.
Hi, this is Dr. Keller, and I'm wanting to bring you some new and exciting information because I went and received some specialized training from the inventor of the O-Shot, created by Charles Runnels. And so we wanted to try it on ourselves before we would introduce it to patients. I've had the O-Shot done, but just this week, Christine had it done, actually just 2 days ago. And so I wanted you to hear her testimonial because I think it's absolutely amazing. So Christine, what was the reason that, and Christine, if you don't know, she is our
Front
desk extraordinaire. So, but what kind of symptoms were you having? Because I know you had a hysterectomy.
Yes.
And so.
So I had a hysterectomy. I've had 3 kids. 3 too many. But coughing, sneezing, laughing, walking down the hall, trying to get to your office, I had to stop because I was leaking.
Wow.
Exercising, I was leaking. Not a lot where I would have to go change, but enough that, anybody, it bothers them.
Right.
But immediately,
So you had a lot of frequency,
having
to go all the time, urgency, having the urge to want to go, and then what we call leakage. If you cough, you sneeze, you laugh. What about with running water?
No, not with the running water.
Okay.
Luckily, because then I would have never done dishes.
And so the O-Shot is actually does 2 things. Number one, it helps with incontinence and it can be immediate. It also helps with orgasm, so that's why it's called the O-Shot, to activate the orgasm system. So before we get to that part, tell me, how long did it take? I did your O-Shot on Wednesday. When did you notice a change?
Well, after the numbness wore off, which wasn't that long, because
we numb you, there's no pain with the procedure.
It's just a little weird because, it's numb when they're touching you, so it's like when you have your mouth worked on and then it's numb and it goes away. But by the time I left, it was not numb anymore, so like around 5.
By the end of the day,
it was gone, and I didn't have to go to the restroom before I left. So, and I work 45 minutes. I live 45 minutes from here, so 45-minute drive, and wasn't rushing to go inside and pee. I went inside to cook, and I was like, oh, I better go to the restroom. So it was really immediate, and even since then, like yesterday, I wasn't running to the bathroom here. And
wonderful.
It was great. It's great.
And so this O-Shot, if you're wondering, it's done with PRP, which is platelet-rich plasma. And what that is your own blood. We're taking your own nutrients and injecting them back into the tissue. And what it does is it activates, we're using our own body's natural ability to heal an area, and that's what's wonderful about it. So so you got the immediate benefit with the bladder, which has to be wonderful. And then what about, did you notice anything sexually, or did you get anything in that way?
Yes, I did.
That's when I go, oh.
Yes.
So what about like wetness in the vagina? Was that better?
Yes. So there wasn't really a problem before, which most people say that there's really no problem. But it was puddles on the bed, wet.
Yes, wonderful.
Yes. We can get restrictive, but we probably would get banned.
And then what about orgasmic function? Did you find that was better? Could you feel more sensitivity inside? And
yes, it was more like, hold on, a little slower. Because if not, it's going to be over and I'm going to be the one out in 2 minutes instead of you. Because sometimes it's that good and it happens. It happens to everybody. And if people say that it does not happen, they're lying. Because it happens occasionally.
Yes.
But yes, it was, my husband said, I think this is the loudest you've ever been. I said, even when the kids weren't here? He goes, even when the kids are in here, this is the loudest you've ever been. With the mouth over my hand. Or wait, my hand over my mouth.
And that's wonderful. I think this is something that we're going to definitely do an update because, this is the immediate response. So we got to get another testimony in a month. So stay tuned, you all. This is something, it may not be something for you. It might not be anything you need, but it might be something that you could tell a friend about. Because this is an area where many of us struggle with our bladders, with urinary, leakage of urine, and that's quite embarrassing, and it really can be disruptive to your everyday activities. And also the fact that you get the added benefit that even if you're already orgasmic, your orgasms are going to be even better, and you're going to have more sensitivity in your vagina. And I can attest to that part as well. It is absolutely amazing. So stay tuned. We'll do an update, and then we'll bring you some other testimonials, because we want you all to know that this is, it's not a hoax. It really works.
Yes, it does.